presentation on her journey into medical school at U of T as well. So um, I'm going to give, I don't know like what she talked about in her seminar, but I'll give you my kind of breakdown of how I prepare for interview and some of my general tips and interview specific types of preparation that I did personally and I learned from others throughout my interview prep. And I hope that will be helpful for people. So let's just get started. So a little bit about me before I begin. So I'm currently a first year medical student at U of T. So I got in from the last cycle. I did my undergrad at Western University in the program Medical Sciences. And so my journey began in high school. I attended high school in Winnipeg, Manitoba, and I went to Western for undergrad, like I mentioned. For anyone who's interested, my honor specialization was in physiology and pharmacology. And similar to Amanda, I applied during my third year. So I took my MCAT the summer after my second year. And beginning of third year, I applied to the four Ontario schools that accepted like third year students, namely U of T, McMaster, Queen's, and U Ottawa. I was fortunate enough to receive interview invites at U of T, Queen's, and McMaster. And eventually, last May, I was accepted at U of T and Queen's and waitlisted at McMaster, and eventually decided to pursue my medical education at U of T. So I want to start with some general helpful tips to get you started in a big picture, because I think you guys are probably waiting for invites coming in. I know McMaster is coming up. I can see from Reddit, so a lot of people are very anxious about it. U of T and Queens is gonna come a little bit in February, I remember. So it's still like a couple weeks you can start thinking about it. So a good thing to do right now as you're waiting for interviews or you have received interviews is to really have an overview, general introspection of yourself. So think about what are the two or three things you can highlight in your application that stood out, that make you stood out. So some things could be like you're a very empathetic person, or you can be a very hardworking person, or you have wealth knowledge working in healthcare that give you specific, introspection and allow you to have very unique insights into working in healthcare and what it takes to become a physician. And I know this is a very cliche question, but start thinking about like the easiest question and also the hardest question you can think about is why do you want to be a doctor? Because sometimes in panel interviews, this question is going to be asked. Mostly US schools like to ask this question, but Canadian schools can also ask this in panel interviews. So think about why you want to be a doctor. Think about some people approach this question from giving like a life experience. So some people can have a defining moment in their youth or in their teenage years or in their adult life that really, cemented their wish or like their drive to become a doctor. I personally don't have that drive to become a doctor, so I approached it in a different way where you kind of highlight two or three strengths or experiences that really prepare you well to become a doctor. So it could be like a quality, it could be like experience, it could be some specific insights, but talk about two or three things that really, really prepared you or made you realize that you would enjoy or you would do well in working healthcare as a physician. So depending on your life experiences, you could go either way from like talking about like experiences and the defining moments, or versus if you don't have like a particular moment that you are set to become a doctor, you can talk about the strength and certain points there. And also, it's important when you're prepping for interviews to start thinking like someone you want to be, right? We always talk about CanMeds. You can think about U of T's four clusters where they're asking you to highlight in your essays. But think about if you were a physician, what are some of the ways or qualities that would help you answer this question, right? If we think about advocate, right? Like how would a physician like advocate for their patients and how would you advocate for whoever in the situation that you're presented with? And another thing is asking for help. It's very useful if you have a group of friends who also receive interview invites to practice together, have like a session together and just talk about prompts. And if you have any mentors in medicine or whatnot, it's good to reach out to them and like ask for their experiences and how to prepare for interviews. And of course, there's lots of amazing consultants like the ones in Accepted Together who's have personal experience of going through interviews and is able to help you and provide their personal tips. So I think being able to talk to limited but also a variety of people is allow you to gain a wider aspects on the methods, the tips, the advice that people give you. And then sometimes not all advice and not all format works on everybody. So like if you feel like talking to some one person and you find that their method is not particularly helpful, maybe reach out to another person or try something that people post on Reddit and find your own method, because interview prep, there's no golden standard and formula to prepare for it. It's really about what you think your strengths are, what your weaknesses are, what format works for you, what doesn't, and finding your own way to it. So I think talking to different people will definitely help out for that. Can you use a sorry, I'll address the questions in the end. I see your question. I'll do it in the end. And another thing is to know your schools, because you wanted to know very well about the schools, especially if you have a panel interview and they ask you things about like why you want medicine, question related to medicine. It's good to have a good understanding of the schools and the uniqueness and special things about their curriculum, so you can reference that when you're in your answer, because schools always like when you are referencing what they did. For instance, Queens, I'll give an example. When they ask you something about a shortage of family medicine or physician in Canada, which is a big issue. And if you can reference talking about your answer about how Queens is doing an initiative with a family medicine Lake Ridge program, then it's a bonus to your answer, because it shows that you are paying a lot of attention in their schools, and you show that you have a desire to attend their schools by spending time and getting to know about their programs and curriculums. And last tip is very important, but also very hard to do in reality, is to really enjoy the process. Because if you get an interview invite, that means the school wants you. They just wanted to get to know a little bit more about you before they make their final decision. That's one of the tips I was given when I was preparing for my interview. So really try to enjoy the process. Really try to showcase your best self. The school just want that a little confirmation from you in terms of meeting you, get to know about you through the interviews to make their final decision to admit into your class. So really try to keep this in mind and keep an optimistic mindset and try to enjoy this process as much as you can, because it really make a difference in terms of motivation and the desire to like actually practice. Okay, in terms of interview, how to prepare for it, as I said, be familiar with the interview types. And for me personally, I feel like some people are naturally eloquent and they can just, talk and talk and be very good at presentation. For me, I'm not really that type of person naturally. So for me, what works is really doing a lot of practice questions, record yourself. So you can do it with your friends and family, but I find it worked best for me personally, is to really video record myself. So I'll do a prompt, I'll video record myself preparing for it, and I'll set a timer and I'll do the question, I'll stop the video record, and I'll watch it again, because watching it again, how it help you is it allows you to not only review the answer to see if there's anything that you said maybe inappropriate or something that you can improve on in terms of content, but it also allows you to look at other things, such as if you have any filler words. Some people, when they're nervous, they talk a lot use a lot of filler words and you don't realize it until you actually video record yourself doing it, and you realize, oh my God, I'm speaking so many and try to consciously reduce it the next time you practice. Another thing is looking at your speed. Are you doing too much of these like hand gesture? Is it getting a little bit distractive? How are you with the camera? Because a lot of schools this year, they're doing asynchronous, so you won't be seeing a real person on the other side and talking to them. So it's really important to make sure you have a really good control of the camera, and like your eye contact is really good and not like, moving up and down and around. So I would highly recommend doing video record. And once you're a little bit more comfortable with the format and the questions, I recommend reaching out to people who have experience with the interview type and do a mock session, right? Because mock sessions allow you to immerse yourself in that testing environment and the stress associated with it, and dress appropriately as if you're doing the actual interview. So this will actually prep you in terms of getting familiar with the environment, the format, the dress. So this is eliminating extra stress that you will face on the actual interview date. So if you can minimize any of these stress before when you're practicing, do it. And I'm sure if you search on internet, there's tons of question bank that you can find for different type of interview invite, MMI, MPI panel. Um, I think doing the questions is not about like doing as many questions as you can, but it's also to be able to familiarize yourself with the question type that you're going to be exposed to, and develop through practice a framework that you can use to approach this type of question, what like regardless of if you have seen this question before or this is a completely new question. So this way you will be fully prepped and ready for your interview. So, how to prepare for the questions. So, I'll give a little bit of a categories that I personally find and also other people shared in terms of the type of question you would expect for the interviews. So, the first big one is personal questions. You will see these kind of questions regardless of what type of interview you will do. So, they'll ask you about like describe a time where you experienced a conflict. Just describe a time to me where you felt like a fish out of water. So these personal questions are designed to get to know more about you, and this is a good time to talk more about your ABS entries, your essays, and kind of expand upon them. So systematically, what I did for these questions is not really focus on doing as many questions as I can, but really systematically prepare like an Excel sheet or Word doc or whatever, and then have a table that summarizes the five above columns. So experience, lessons, future application, value, and type of question. So go through your ABS, look at each entry you have, and think about one or two experiences. It could be more if you have more, that you can use and talk about in your ABS, right? Like a little story. So for instance, I give an example here that, for instance, I volunteer at the hospital. That would be my experience. So I would talk about I volunteer at the hospital, maybe at the cancer unit, helping patients, providing information. And the most important part you should focus on in your interview is the lessons you learn from this experience. Whether it's the lessons you learn, any insight, any personal growth, it's very important to talk about what you learn as opposed to just describing the experience. The experience can be impactful, but the admission officer wouldn't know until you actually highlighted what you learned and what you reflected from this experience. For instance, I wrote, I resolved misunderstanding with a patient in a high stress environment by doing this and this and this. So that would be my lessons learned. And then later on, the final part of your answer in terms of answering a personal question is like a future application. So if you learn to resolve a misunderstanding with a patient, how would this help you in a future career in medicine, right? Maybe because in a future career, you may be exposed with a patient who is highly emotional in a high stress situation. How would you use the skills you learned today and resolve that conflict with a patient in the future? Or you will say, as a future physician, I aspire to continue, maintaining a two-way communication with my patients so they can make informed and collaborative decisions with me together about their healthcare decisions, right? So that would be your future ending. And values, the value column is just kind of like help you to narrow down your strength that you showcase in this experience. It could be communication, empathy. So this will be fitting into the ChemMeds columns or the UFT for clusters. And the last column isn't really necessary, but is good for you if you are trying to brainstorm the type of question you might be exposed to. Because as you see in the last column, I wrote type of question, I wrote failure, conflict, empathy, and stress. So this shows you that depending on the question stem, your emphasis on the experience could be different. And you can use the same experience and kind of change the storyline and what you learned and apply it into different questions. So really one experience, you can use it for multiple questions. So if you imagine having one single experiences and keep building it in your ABS until you have this big Excel sheet with experiences, you will be pretty much set for any personal questions that comes your way because you will be ready. You have the experience in your head, you have practiced them, and you can just kind of say it and present it the day of the interview. Okay, and then the last two type of question is situational or policy questions. I'll go over the situational questions first. It's very like thinking like Casper, where they'll give you a situation, a hypothetical situation involving ethics, conflicts, confidentiality, making a decision out of a dilemma, and then you will just kind of use your structure to answer this. So one big thing I want to highlight in terms of answering situational and scenario questions as opposed to Casper is you want to be more genuine in your answer. Because I know for Casper, we had this formula where we say we want to be, non-judgmental, non-confrontational, and approach in a private setting. Sometimes it's kind of like robotic and like a formula. You want to make sure it's less obvious when you're actually talking in your interview because interviews you want to be ethical, you want to make the right decisions, you want to explain your thought process, but you also want your answers to be realistic. Sometimes the answers we sometimes say on Casper may not be really realistic and feasible in real life. So it's a little bit harder in the interview setting because you want to think about the realistic things that you would actually react and do in a real life setting, right? So for instance, if you see your supervisor, if you're a medical student and you smell alcohol breath from your supervisor, what would you do, right? Like think about like if you're actually in that situation, what are the steps you would do, how would you gather your information realistically, how would you approach, like what are some realistic situations that could happen. For instance, a realistic situation could be your supervisor have alcohol breath because of uncontrolled diabetes. Some people have ethanol breath, and this is a realistic situation that could actually happen, right? Instead of they had alcohol breath candy. Like it's very, very weird and it wouldn't happen in real life. So think about realistic situations and how you solve them. So a little bit more challenging. But I find really helpful for prepping for these situational questions outside of your prepping time. In real life, if you're just walking on the street, you're going to classes, if you're going to work, and then you just look at a situation and then kind of make it worse. So if you had a conflict with your coworker and think about making the situation the worst possible, like very catastrophic. Make up like a hypothetical situation based on the situation you're currently in, and think about if I were in that situation, how would I approach the situation, how would I resolve it? I find that way because it's linked to your real life. You are thinking more realistically, and you're actually thinking from your personal experience. So I find that more helpful. In terms of policy questions really just kind of checks out your knowledge about healthcare and what you think about the healthcare issues in Canada. I find that if you search on Reddit, if you search healthcare issues in Canada. I remember when I was prepping last year, there was a big document floating around on Reddit, in the pre-med Canada Reddit, that was people collected like a bunch of information on like the current issues that is prevalent in Canada, and it's a good foundation to get started to get yourself immersed in getting to know the type of issues that is existing in Canada if you're not very familiar with healthcare, and then think about which part are you not really familiar with and do extra research on them. And one personal thing I really liked is reading CBC News. So CBC News, they have their healthcare sector. You can like look at that sector only. And then so for me, I just in the morning, when I was eating breakfast or whatnot, I'm just gonna read up one or two articles that interest me. I think is really interesting. And when you read these articles, don't just read them like passively, actually critically analyze what's happening in the article. So if they're presenting a policy to solve, you know, family doctors shortage in Canada, do you agree with this policy? Do you disagree? Why do you agree? Why do you disagree? What are some arguments that support your decision? And if you disagree, how can you make improvements or alternative solutions to the issue presented in the article? So I find just doing this one or two per day and accumulatively, it's a good way to build your healthcare knowledge a lot. And then by the time you're at your interview, you have tons of knowledge that you can talk about if should they ask you any questions about healthcare. Okay, so now I want to just want to quickly go over the type of interviews that you might get exposed if you're interviewing for Canadian medical schools. So the most traditional way is panel, right? It's more like they ask you a question, you have to answer right away, like a job interview. It's very, very personal. You want to go with the flow and make it very conversational and less obvious structures. So um, this is a contrast to MMI, which I'll talk about later, where in panel, you want to make your answers relatively short. You don't want to speak more than like 3 minutes because at that point, you're just doing your own monologue and the person just kind of listening to you passively, and it's not really an interaction. And then this, as a result, may make them lose interest in you. So you want to keep your answers very relatively short. You still don't want to like end it in 30 seconds. You want to keep it like 1 to 2 minutes. But you will hopefully anticipate for any follow-up questions. So if they ask me, tell me about yourself, and I told them about a couple experiences I had, they might in another question later in their interview be like, so you mentioned, you do volunteer work at this. How would you, blah, blah, blah. And they may ask you a question about the things you mentioned in your interview, right? So if you want to expand on something, maybe just mention, but you don't have time to go over it, maybe just mention it briefly. And then if they're interested, they might prompt you to speak more about it. And in terms of the question type you might be expecting in panel, it could be a mixture of personal plus situational questions, or predominantly personal slash opinion questions. So they could still give you a situational question and you just kind of have to answer right away on your feet. So as you can imagine, this is probably not a very elaborative answer as you would for MMI or writing for your Casper, but you still want to have that general framework of, gathering information and making sure you're not making anything with bias or judgments and proposing multiple potential situations that could be happening in the situation and end it there with a strong conclusion. And one thing I noticed about panel is like most of you want to try to engage your audience because you want to make the conversation very interesting and engaging and like two-way. You can take occasional pauses if you feel like you're speeding up a lot. This way allows you to take a breath and think about your answer, and then this also allows the interviewers to like think about your answer and really process what you just said, and instead of just kind of like go on and on and on. I find it's helpful to use conversational phrases in panel to make it a little bit more, almost a little bit more engaging and casual. And occasionally, if it's a situation permits, you can make like a joke or two to lighten up the mood. But this really depends on the situation, and don't make a joke when the conversation is really grim and it's very, very sad. But like if this is like a thing about yourself and something you're showcasing yourself, you can make a joke or two to showcase your characteristics. MMI is invented by McMaster, and it's currently used by McMaster and Queen's in terms of their first round of interview. In terms of Ontario schools, I mean. So basically, many station you'll rotate through. The exact format differs between school. McMaster, they have their MMI as asynchronous, where you will interact with many different interviewers for multiple stations. Whereas Queens, they do it asynchronously, meaning you'll see the question prompt show up, you'll deliver your answer, and no person will be present at your interview. So you can start practicing when you're preparing for like when they give you the preparation time for your question. You can start practicing by jotting down notes, like tiny bit of a bullet points to prepare for your answer, but try to become more independent and not take notes later because some MMI doesn't allow you to take any notes during the preparation period. So it's good to be independent and not rely on your notes when you're actually doing the interview. Again, you want to make your answers realistic, but also genuine, right? And then if you're doing this synchronously, like for McMaster, for if I remember correctly, McMaster give you 8 minutes to answer each prompt. And you want to leave at least 2 to 3 minutes in the end to allow for interactions because they will have some prepared questions, follow-up questions for you, and you want to leave the time so that interviewer can ask you those questions and you can answer those follow-up questions. So when you're practicing, don't practice with that you have 8 minutes in mind. Try to practice and end your answer within 5 minutes. That way you'll allow sufficient time to interact with the interviewer, and then you can showcase, it's a more diverse and unique answer from the follow-up question. And the last type is really unique to U of T. It's the VMPI. You have 4 questions in total. You have 3 minutes to prepare for it and 5 minutes in response, and you're assessed by 4 different reviewers. U of T is very personal based and is evaluated based on the 4 core competencies that was also evaluated in your essays. Uh, my personal experience with VMPI is it goes really fast. It goes faster than you think because you will have time to take breaks in between the questions. For me personally, I will kind of just rushing through the questions, so I didn't really take my pauses between questions. So my personal advice after doing this is to take your time. If you're a person who needs a little bit of a break to clear your mind after each question, take it. Do not rush the questions because you have emperor. I think they give you like 1.5 hour or 1 hour to finish the interview. So you have almost double the time to finish it. So take your time, do not rush the questions, and then rest as much as you can before you begin the next question if you feel like you need it. Compared to the MMI, I feel like this one is more leaning towards getting to know more about you as a person. But situational and policy question may still come up, but try to incorporate your personal experiences as much as you can, especially for questions they ask for your opinions or things they ask whether you agree or disagree with. Okay, and at the end, I just want to introduce a little bit of my package. So my hourly rate is 48 USD an hour. I do interview prep for basically everything. So because I've interviewed at McMaster and Queens for their MMI, MPI for UFT, and panel for Queens. So I can do basically all the interview types that you can think of. In terms of my session, usually it's about an hour. We can do like an introductory session where we go over general overviews, tips and tricks. If you need help planning and getting started on practice questions, we can do that. We can do a couple questions that we can take them up and like discuss them. Or if you feel like you're ready to get started with a mock interview, it will be like we start with a mock interview. Basically, I will stimulate the exact test in like interview environment, whereas in terms of the question type, the format, how much time you have for preparation, how much time for answering, how much time for follow-up, I'll stimulate exactly as it is for the actual interview. And then in the end, I'm gonna leave like 10 to 20 minutes for feedback. I'm gonna give you advice and feedbacks on your performance and hopefully practice on improving your answers if we have time left. And I do offer a 5 hour bundle discount for people who wants to get like started for like a continuous session throughout the interview preparation month. So let me know if you need anything. And also I'm open to having different sessions and like different ideas that you want to incorporate it. So just message me and let me know if you have anything in mind. All right, and that concludes my presentation. I hope it's helpful and offer a little bit like a